What's up, beautiful people? Another day, another study. Chronic hypersensitization syndromes are something that we see all the time in clinical practice. I suffer from probably three of these. I've had migraines, which there seems to be a genetic component because everyone in my family has them. There's irritable bowel syndrome, which I have. And then there's also fibromyalgia. So, depending on the time point, I've actually met the 2016 College of Rheumatology criteria for fibromyalgia. Therefore, this is an area that I pay attention to quite well. And luckily, I found things that have mine under control without any type of medication. So, fibromyalgia is a chronic hypersensitivity syndrome. It's characterized by muscle and joint pain, fatigue, sleep disorders, and disability. It's thought to affect between 2 and 4% of the world's population, mostly in women. And previous evidence supports resistance training in improving pain intensity, tender joints, and function. What's been new in the science is this concept of pain neuroscience education, and that is a way to reconceptualize pain. So, in this study, the pain neuroscience education had several points, including neuroplasticity, the pathology of pain, the links between injury, pain, and the nervous system. And this type of education has been shown to reduce chronic pain. So this study evaluated a combination of resistance training and pain neuroscience education to aerobic activity and flexibility exercises, which is currently part of the standard of care for patients with fibromyalgia. One key difference is, and I don't know why they designed it this way, it seemed like they were setting up the resistance training group to fail, was that that group was told to stop their pharmacologic treatment while the other group was told to continue it. Even despite that, the resistance training PNE group saw greater reductions in pain intensity at the beginning of the trial with a large effect size that was clinically important. Both groups saw improvements in disability with no significant difference between the groups. When they looked at pain thresholds in a trigger point area in the trapezius, their thresholds were improved in the resistance training group, but not in the aerobic group, in the trapezius, but not in the quadriceps muscle. So interesting findings. This was a small study, short duration. And again, it's kind of puzzling that they stopped the medications in one group. Seemed as if they were biasing against the efficacy of that group. However, this adds to the overall body of literature showing that exercise and therapies related to the neuroscience of pain are important for these chronic hypersensitivity disorders.